Now this is the joint 1 classification, and myself Dr. Avantika Krishna Bamne. I am professor in the Department of Anatomy, and today I will discuss about the joints. So now joint, what is the definition of joint? Joint or articulation is connection between two or more bones, and long bones articulate by their ends, flat bones articulate by margins, and in short, the irregular or short bones articulate by their surfaces. That means long bones articulate by their ends, flat bones like suppose skull bones are there, they articulate by their margins, and long bones articulate by their ends. So irregular bones by articulate by surfaces, or short bones like suppose carpal bone is there, so it is cubical in nature and having the 6 surfaces, out of which 4 surfaces are articular. So that is about the joint. Which are the related terminologies? Arthron in the Greek word, that is called as joint. Then articulatio, so that is the in Latin word, it is again the joint is there, and junctura is a joint. Now what is about the syndesmosology? So in Greek word syndesmosis, that means the ligament, study of the ligaments and related joints. So this is the arthron, articulatio and junctura. So that means syndesmosology is the study of ligaments. So how the words they are derived? Arthrology, arthritis, so inflammation of the joint, so that is the arthritis. So how the uh, words they are derived. Now, so here, what is the structural classification? Fibrous joints. So according to the structure, joint can be classified as fibrous joints, cartilaginous joints, and synovial joints. Now, fibrous joints can be studied again under the sutures. Then there are syndesmosis and gomphosis type of joint. Then there is the primary cartilaginous type of joint, and which is also called as synchondrosis. And then there is the secondary cartilaginous type of joint, which is also called as the symphysis. So sutures, syndesmosis, gomphosis can be studied under the fibrous joints, and primary cartilaginous joint, synchondrosis, secondary cartilaginous joints are also called as symphysis. Now synovial joints can be studied under the, which are the subtypes of synovial joints, which are highly freely mobile joints. So ball and socket, saddle type of joint, condylar type of the joint, ellipsoid type of the joint, hinge joint is there, pivot joints, and plain synovial joints. So these 7 subtypes or varieties are of the synovial joints. Now, according to the functional classification means according to the degree of mobility. So, according to the degree of mobility, functional classification is synarthrosis or immovable type of joint like fibrous joints. Then there are the amphiarthrosis, that is the slightly movable like cartilaginous joints, and diarthrosis, that is freely movable or like synovial joints. Now the synarthrosis type, they are the fixed joints, no movement is possible. Articular surfaces are joined by tough fibrous tissue. Articular surfaces are joined by the sutural ligaments or sutural membranes are there. Sutures of the skull. Then here slight movement is possible in case of amphiarthrosis type of joints. Pad of cartilage lies between the bones. Cartilage act as shock absorber. Intervertebral discs between the bodies of vertebra. Intervertebral discs between the bodies of the vertebra. Then now this type of joint is amphiarthrosis, According to the degree of mobility, they are called as the slightly movable joints. Freely movable joints, fluid filled with the cavity between articular surfaces covered with the articular cartilage, and they are the freely movable joint. Synovial fluid is produced by the synovial membrane. Synovial fluid act as lubricant, and now so this is about the synovial joint. So freely movable joint is there, fluid filled cavity between the articular surfaces that is present. Articular surfaces are covered with the articular cartilage. Synovial fluid is produced by the synovial membrane in the joint cavity, which is freely present in the joint cavity, and synovial fluid acts as lubricant. Synovial fluid act as the lubricant. Now, angular movement, flexion, extension, abduction, adduction. So, how many types of movements there takes place at the synovial joint? Angular movements are decrease in the angle of decrease in the decrease in the angle between the bony surfaces. So that is called as the flexion. Increase in the angle, that is the extension. Any part moving away from the body, abduction. Any part moving towards the body, that is adduction. And again rotatory movements are also there, rotation. So rotation, turning upon an axis. So vertical axis is there. For flexion and extension, movements taking place at the transverse axis. Abduction, adduction movements taking place at the anterior posterior axis, and rotatory movements taking place around vertical axis. Circumduction, combination of all the movements, that is circumduction. And gliding, one part slides over the another. So gliding type of movement, one part slides over the another. Now regional, according to the regional classification: skull type immovable, vertebral type slightly movable, limb type, that is the freely movable. So skull type, that is the immovable joint, that means fibrous joint it is compared with the fibrous joints, and how the joints of the skull. Vertebral type means, suppose one has to explain about the cartilaginous type of joints and secondary cartilaginous type of joint. Suppose means in between the intervertebral disc, body of the vertebra, there is intervertebral disc slightly movable. Limb type, that is freely movable. Limb type, that is the freely movable. According to the number of articulating bones, simple joint means in the joint cavity there are two bones. Compound joints, more than two bones. So simple joint, two bones are there. Compound joint, more than two bones. And complex joints, so articular disc or any fibrocartilaginous disc or meniscus is present in the joint cavity, dividing the joint cavity arbitrarily into two compartments. That is the complex type of joint. Two bones articulate, interphalangeal joint. So now suppose for example shoulder joint is there, hip joint is there, interphalangeal joint. So there are only two bones, they are present in the articulating means articulation. So in the joint is formed by two bones. Compound joint, so this is the elbow joint, more than two bones articulate within the one capsule. Elbow joint, wrist joint, elbow joint and the wrist joint. Joint cavity is divided by articular surface into the uh, intra-articular disc or meniscus into two compartments, and temporomandibular joint, acromioclavicular joint, sternoclavicular joint articular disc is present, which is responsible for the uh, two joint cavities are there, two separate movements are taking place. Fibrous joints. Bones are joined by fibrous tissue. Immovable joints, they are permit slight degree of movement. They are the immovable joints. They permit the slight degree of movement. Sutures are there peculiar to the skull, are immovable joint. Sutures are there peculiar to the skull, are immovable joints. According to the shape of the bony margins, suture can be plain suture, intranasal, serrate suture, interparietal suture, squamous suture, temporoparietal suture. Denticulate suture, example is the lambdoid suture. Shin dialysis or wedge and groove type of the suture, that is the rostrum of the sphenoid and upper border of the vomer. Upper border of the vomer and rostrum of the sphenoid. Denticulate is the lambdoid suture. Squamous suture, temporoparietal suture. Serrate suture, interparietal suture. Plain suture, intranasal suture. So these are the different. So in the plain suture, two quadrangular bones, they are there in the skull. Here nasal bones, intranasal suture, serrate suture, interparietal suture, squamous suture, temporoparietal suture, denticulate, lambdoid type of the suture. Shin dialysis, rostrum of the sphenoid and upper border of the vomer. So now this is the plain suture where the two nasal bones here, suppose for example intranasal suture, sutural ligaments, or with the help of sutural ligaments and sutural membrane they are united. Fibrous suture, fibrous type of the joint. Then serrate suture. So in the serrate suture there are serrated margins are there, irregular serrated margins are there. Serrate suture, sawtooth appearance. Example is the interparietal suture. Squamous suture, that is the squama means flat. Squamous temporal bone when it is articulated with the parietal bone. Temporoparietal suture is the example. Denticulate suture, how? So tooth-like extension, denticulate suture, and then it is articulating with the another reciprocally concave another bone. So denticulate suture, lambdoid suture, shin dialysis, wedge and groove suture. So ala of the vomer and rostrum of the sphenoid. Ala of the vomer and rostrum of the sphenoid. So that is the shin dialysis or wedge and groove suture. So here we can see that now this is the serrate suture or sagittal suture, lambdoid suture or here denticulate suture. Now here squamous part of the temporal bone, squama means flat, flat suture is there articulating with the this parietal suture, parietal bone. So temporoparietal suture. Temporoparietal suture is the squamous suture. Shin dialysis type of suture where it is present. So shin dialysis type of suture is present at the ala of the vomer and rostrum of the sphenoid, sphenoidal rostrum, and here wedge shaped vomer bone is there. Now see. So here rostrum of the sphenoid and the vomer bone which is forming the midline nasal septum. In the lower part it has two wings like ala and inside which fits the means joint is rostrum of the sphenoid. So here, so this is the vomer bone and these are the two ala of the vomer bone. This is the vomer dividing the nasal cavity into right and the left nasal cavities. This is the vomer bone and in the lower aspect, now it is divided into the two parts, wings like extensions called as ala of vomer, and here is the rostrum of the sphenoid bone. So shin dialysis type of joint, wedge and groove type of the joint. Now six specific points on the sutures in newborn skull. They are the membrane filled gaps. Allow the underlying brain to increase in size. So these are called as the fontanelles. So fontanelles, they are the unossified membranous gaps which are present at the four angles of parietal bone. Anterior fontanelle is also called as the bregma, which is diamond in shape. Then here is the anteroinferior or sphenoidal fontanelle. Now posterior here is the posterior inferior, that is the uh, mastoid fontanelle, and this is the posterior fontanelle. So anterior fontanelle, now it get completely ossified or it closes at the 18th month of the after birth. So at the 18th month of life. So at the 1.5 year of life, so in case of a child, and then in case of child, so here this anterior fontanelle get closed. Then anterior inferior, rest of the fontanelle, anterior inferior, posterior inferior and the posterior fontanelle, they will close at the 6 months after birth. 6 to 8 months after the birth, they get closed. So these are the three other fontanelle other than the anterior fontanelle. Now what is the importance of fontanelle? Now suppose in case of the parietal bone, ossification center, it starts in the ossification center for parietal bone start at the parietal tuberance, and like spokes of the wheel, it will just get radiated centrifugal direction, and so that the margins of the parietal bone, they will get ossified first, leaving the gap at four angles of the parietal bones, and they are called as unossified membranous gaps, which are called as the fontanelles. Now, so here anteriorly in case of a fetal skull, for, so this is the diamond shaped gap is there. Frontal bone in case of fetal skull is also in a two equal halves, and now afterwards it will get fused, and now this anterior fontanelle or diamond shaped fontanelle, it is also called as the bregma. Now importance of the fontanelles, so they provide growth for the underlying brain, and they provide molding of the skull during the childbirth, and also depression of the anterior fontanelle bregma indicates the state of dehydration in case of newborn child and in case of infants, and if it is gets swollen and elevated, then it indicates the underlying intracranial raised intracranial tension, raised ICT. So such importance of the fontanelles are there. So two important points. Now what is about the syndesmosis type of joint? The bones are connected by interosseous ligament. Inferior tibiofibular joint. Bones are connected by interosseous ligament, inferior tibiofibular joint. So now this is the here the interosseous tibiofibular ligament at the inferior tibiofibular joint, and this is joint syndesmosis type of joint is inferior tibiofibular joint. What is the gomphosis? That is the third variety in the sutures. In the fibrous joints. Fibrous joint can be classified as sutures, different types of the sutures along with the examples we have seen. Then there is the syndesmosis type of joint, and then there is the gomphosis type of joint. Gomphosis is nothing but the peg and socket type of the joint, and it is root of the tooth in its bony socket. It is fixed. Okay. So root of the tooth, bony socket, that is the peg and socket type of joint, that is the gomphosis. Primary cartilaginous type of joint, also called as the synchondrosis or hyaline cartilage joints. They are the synchondrosis. Bones are united by plate of hyaline cartilage so that joint is immovable. The joints, primary cartilaginous joints, they are temporary in nature. After certain age, the cartilaginous plate is replaced by bone. So joints are temporary in nature. After some certain age, the cartilage plate is replaced by bone. Synostosis occurs. Hyaline cartilage is existing between the two. Which are the examples? Examples of the primary cartilaginous type of joint: joint between epiphysis and diaphysis of long bone, joint between the epiphysis and diaphysis of the long bone, spino-occipital type of the joint, spino-occipital type of joint, first chondrosternal type of joint, first chondrosternal type of joint, costochondral joints, costochondral joints, and here is the epiphyseal plate of cartilage. Epiphyseal plate of cartilage exists between the epiphysis and diaphysis, and this epiphyseal plate of cartilage is the growth takes place here, and this is the first chondrosternal and costochondral joints are also primary cartilaginous type of joints. Costochondral. Symphysis types of joints, they are also called as the fibrocartilaginous type of joints. Articular surfaces are covered by thin layer of the hyaline cartilage, united by disc of fibrocartilage. They are permanent and persist throughout the life, and these are the secondary cartilaginous type of joint. How so? Articular surfaces are covered by hyaline cartilage, and in the middle there exists the fibrocartilage. Articular surfaces, they are covered by the hyaline cartilage, and exist in between there is the fibrocartilaginous disc. They are permanent, persist throughout life, they are midline in nature. So here is the symphysis pubis. So here is the symphysis pubis. Symphysis, pubic symphysis. So it is present in the midline, and it is a type of secondary cartilaginous type of joint. Secondary cartilaginous type of joint. Pubic symphysis. So fibrocartilaginous disc is present, and it acts as a slight movement is possible in case of females during the childbirth. Secondary cartilaginous type of joints occurs in the median plane. Symphysis menti, though it is misnomer as it is synostosis. So classical examples of secondary cartilaginous type of joint: symphysis pubis, manubriosternal joint, intervertebral joints between the vertebral bodies. Intervertebral joints between the vertebral bodies. Now what is the disc prolapse? So sciatica is the disc prolapse, means sciatica. How, what is the disc prolapse? So intervertebral disc, it is made up of annulus fibrosus, which is made up of the white fibrocartilage, and centrally there is the nucleus pulposus. So that nucleus pulposus consists of the remnants of notochord, and also the neurochemicals are present, and on each side of the vertebral column there are the roots of the sciatic nerve, or any nerve roots they are present for the lumbar plexus and lumbosacral plexus, and whenever there is tear in the annulus fibrosus, which commonly occurs during the second decade of life after the heavy weight lifting. The persons who do heavy weight lifting, or the any persons who exercise in the gymnastics, and suppose heavy weight lifting is there, and so there is in the second decade of life, the person, they are very prone for the tear of that annulus fibrosus, and that is called as the disc prolapse, or that is also called as the slip disc. So that nucleus pulposus that comes out through the that gap between the two vertebra, and then it has the neurochemicals which irritates the roots which are just present on each side of the lumbar vertebral column, lumbar nerves, and the lumbosacral nerves are there. So any pain that is in a distribution of sciatic nerve, that is the pain is there on a in hip region on particular side, and then on the back of the thigh, and also radiate to the lateral aspect of the thigh. हेलो हाँ ठीक है रुको. Then there is the dislocation. So if suppose from the joint cavity, if any bone that is dislocated from its joint cavity, then it is called as the dislocation. If suppose the shoulder joint, in case of shoulder joint, humerus is there, head of humerus, if it gets skid from the glenoid cavity, then it is called as dislocation. Sometimes not a complete dislocation occurs, and only the partly dislocation occurs. So partly the head of humerus is dislocated from its joint cavity, just partly, half dislocation, and that is called as the subluxation. Now what is the rheumatoid arthritis and what is about the osteoarthritis? So difference between two, osteoarthritis is the degenerative condition, degenerative disease. It often occurs after the 60 years of the age, and in case of large weight bearing joints, there is wear and tear of the articular cartilage, and that reduces the this joint space, and in the joint cavity the joint cavity space is decreased, and so there is the friction between the bones which leads to tremendous amount of pain, and a lot of pain is there uh, in the weight bearing joints like knee joints and the hip joints. Rheumatoid arthritis is the chronic inflammatory condition. It is inflammatory condition. The synovial membranes of the small joints of the hand, it will get thickened, and there is the deformities in the fingers. Morning stiffness is there in the rheumatoid arthritis, chronic inflammatory condition, and then that is the rheumatoid arthritis. So just like that, disc prolapse, that is sciatica, dislocation or complete dislocation or partly dislocation is there, and then there is the rheumatoid arthritis and osteoarthritis. So such like that, in this video we have seen about the joints, fibrous type of the joint classification, different way of classifying the joints, structural classification, regional classification, and there is the how structural functional classification, but very commonly structural classification is most commonly used, under which the joints can be classified as fibrous joints, cartilaginous joints, synovial joints. Synovial joints and fibrous joints, they are the sutures. Different sutures are there, like plain suture, example intranasal suture, serrate suture, example sagittal suture, denticulate suture, example lambdoid suture, shindialysis, rostrum of the sphenoid and ala of the vomer, and then syndesmosis type of another variety of sutures, inferior tibiofibular joint, Gomphoses are also called as the peg and the socket type of joint. That is the gomphoses, peg and the socket type of joint.